I think this is a comment on our society that, it's a woman's disease, right? So it doesn't get the same attention as
Yeah.
men's diseases do. So you need at least 400 micrograms per day of folic acid.
Okay.
Most prenatal vitamins will have like 1 milligram of folic acid, and that's fine. If you live in this part of Canada, there's a lot of vitamin D deficiency. I would say 2/3 of my practice is vitamin D deficient. Make sure you're taking your folic acid. Women are more likely to have adverse reactions to medication. It speaks to the fact that in a lot of the studies, that pharmaceutical companies run, they don't include a lot of women in their studies. And so the dosing is really designed around men.
And
There's a tendency to think it's always the woman's issue. But we have to remember that the men are contributors too. So, they should also be, quitting smoking, reducing their caffeine, reducing their alcohol, improving their diet, exercising, all of those things, taking antioxidants. So don't forget about the men.
hi, everyone. Welcome back to Black Fertility Agency's channel. If you are new here, welcome, welcome. My name is Patricia, and I'm the founder at BFA. And throughout the past month, we have been spotlighting different fertility doctors. And today we're back with another great interview. And I'm so excited and honored to chat with today's guest. Hi, Dr. Williams. How are you?
I'm good. Thank you, Patricia. How are you?
I'm good as well. So before we kick off with the questions, I just want to read your biography for those who are listening online or who are watching on YouTube. So Dr. Tanya Williams has been practicing obstetrics and gynecology, infertility, and reproductive endocrinology in Toronto since 1993. Recognizing the needs of couples in Toronto and Durham, she has expanded her training and practice to focus on treatment of patients with infertility and related issues. Dr. Williams offers patients thorough investigation and the most up-to-date treatments using a caring and sensitive approach. Now, along with this, I personally want to say that Dr. Williams is the epitome of a physician that puts patient care first. We became acquainted last year, and I haven't met a single person that doesn't rave about her work ethic, her dedication, integrity, and personality towards patients. So, Dr. Williams, welcome. I have so many questions for you, and I think I want to get started with what inspired you to specialize in fertility medicine and what keeps you passionate about it?
Well, thank you for that very kind introduction. I really had my own fertility journey back in sort of the mid 1990s, and I needed to do IVF, or at the time I was told that I needed to do IVF. I was not successful with IVF actually, and so it was a tough moment for me at the time. Now, luckily for me, I was fortunate enough that I was able to go on and actually have 3 children spontaneously. So 3 pregnancies spontaneously, and now I'm blessed with 3 great kids. So
That
yeah, it was definitely a journey, and I think just it gives me certainly empathy for my patients that I look after now, and keeps me invested for sure.
Yeah, absolutely. So then I guess that segues into my second questions is how do you ensure patients feel heard and supported throughout their journey at when they come to you?
Well, I mean, I think that is very important. And we try to start at the very beginning of their journey. So, the first touch point being when they call in to make that first appointment.
Mhm.
So I hope that I've, managed to put together a team of professionals who are knowledgeable, who are efficient, but also compassionate and kind. And we try to, meet people where they are, get to them quickly in terms of, trying to answer their questions right away, and treat them with the kindness that we would want to be treated with.
Yeah.
Um, so like friendly communication, answering questions, smiling faces at the front desk, our lab staff and ultrasound partners, it's not really my staff, but ultrasound partners, try to get to know the patients and, get to know their preferences and make them feel at home while they're in the clinic, because often they have to be there like daily or every 2 days, right? So you feel like you're kind of stuck there as a
Yeah, I love how you explain it as it's more than just you. There's so many different people who plays a role to making sure that patients feel supported, from the front desk to the people who do the ultrasounds and everyone in between. It's kind of like a team effort. So
Mhm.
that's really incredible to hear for folks who are interested in what Dr. Williams' practices consists of. So my next question for you is, what's something unique about your practice or your philosophy that sets you apart from other fertility specialists?
Well, so not that this is just for women, but we are an all-female team and ethnically very diverse. So, although it's a small team, we have lots of access to different languages spoken.
Hmm.
And I think that makes patients feel at ease when they come in to the clinic. I think it helps to see people who look different, and for a lot of people, to see somebody who looks like you, right?
Yeah.
So I would say that's probably our most unique feature.
I think diversity is the biggest strength that clinics can have, especially when someone comes to the clinic. It's really great to see, oh, it's not just a monolith. Like there's so much richness in the staff members. And now, this last question before we get into the community members' questions is, if you could bust one common myth about fertility, what would it be?
Well, there are a few, but I would
There's
say
a lot.
So often, people say, and it's very frustrating to hear this, just relax and it'll happen, right? I would say that's a big one, because it's not that you're contributing to your infertility by or subfertility by, feeling stressed. It may be a small component, but it's not the major component. And I think just to hear that from people in your community or people in your family, it sort of minimizes what you're going through and presupposes that, I'm doing this to myself. I can actually fix this, right? And so that's a little bit, I'd say it's not helpful,
Yeah.
and it's certainly not most often not true.
Yeah, and you are right. There's so many other factors that plays a role into someone's potential infertility that, stress is a component. It may not be the most important component, but it does play somewhat of a role. But it doesn't make it easier when someone's just like, oh, you just need to go on a vacation and you'll come back pregnant. Because I've heard that before as well. Um, that's not the case for a lot of people, unfortunately.
No, no.
And if it was that easy, I'm sure we would all go on vacation and come back.
Exactly, exactly. It happens on occasion, right? But
Right,
it's there's more to it than just the relaxation.
definitely.
Timing, etc., right?
Yeah, absolutely. Okay, so we received an overwhelming amount of questions from community members, so we'll try to get through as many as possible just for
Okay.
time. Are you ready, Dr. Williams?
Yeah, I think I received the questions too. So yeah, that was
Yeah.
helpful.
Okay. Awesome. Let's dig into them. The first one is, all my life, my family made it seem like it was so easy to get pregnant, and discussions were about how not to get pregnant and to focus on my career. Now I'm 34 years old, struggling to get pregnant with my husband. What is your advice for me?
Well, I mean, I think first of all, if you've been trying for 6 to 12 months and you're 34 years old and you haven't been successful, I think it's definitely time to get help. So I would ask my GP to, refer me to a fertility specialist. I think that's the first step.
Yeah.
Sometimes you might have to wait a while. So I'd say get that ball rolling. But while you're waiting on that to happen, make sure that you're optimizing all the other things in your life. So make sure you're taking your folic acid. So the recommendation for folic acid is that you need at least 400 micrograms per day of folic acid. Most prenatal vitamins will have like 1 milligram of folic acid, and that's fine. So, take a prenatal vitamin. The other thing that I find certainly in my practice, and if you live in this part of Canada,
Yeah.
there's a lot of vitamin D deficiency. I would say 2/3 of my practice is vitamin D deficient. So make sure you're taking a vitamin D supplement. And,
I'm
there
taking
is.
notes for myself at this point. Sorry.
So yeah, vitamin D deficiency, can be associated with, miscarriage. It can be associated with some pregnancy complications. So it's a good idea to be, vitamin D sufficient, I would say. So take a supplement. Probably it's likely that when you go to start your testing anyway, they might check for vitamin D deficiency, especially in this area. Again, because we have very little sunlight in the GTA. So often patients are vitamin D deficient. And also there are a lot of patients of color. And patients of color typically don't absorb the same amount of sunlight, so they don't get the same vitamin D conversion. So if you're a person of color, you're more likely to need vitamin D supplementation.
Wow. This is the first I'm even hearing of this. Okay. I hope that answers, and I believe it does answer that first person's question.
I think there's some other things that I was going to suggest too, like just optimizing lifestyle things,
Okay.
like, diet and exercise and making sure you're getting enough sleep, 7 to 9 hours of sleep.
Seven
No,
to nine?
7 to 9 hours of sleep. Yeah. Yeah.
Dr. Williams, do you get 7 to 9 as well? Or you try to?
I try, but I'm not always there, but I try.
I know I get like 5 if I'm lucky. But
Yeah,
7 to 9.
we're
Okay.
we're we're all sleep deprived, I'm sure. Yeah.
Yeah. Okay. 7 to 9. Gotta
Yeah.
note that down.
Minimizing caffeine, making sure you're not taking too much alcohol. If you smoke, stop smoking, all of those things. And also minimize your stress levels. Like, we were talking about stress before. Minimize your stress levels.
Yeah. Yeah. I think with a lot of folks who work 9 to 5 jobs and then they come home and all of the things, these are really great tips for those who are listening, especially the vitamin D supplement. That's something that I strict for myself because well, let's not talk about me. Let's go into the next question. And
Okay.
maybe we'll have time to talk about me. So our next question was PCOS viewer here. What are my chances of getting pregnant naturally, currently in my late 30s?
So I would say it's very variable. If you don't have PCOS and you are ovulating, the chances of getting pregnant in your late 30s are probably somewhere between 10 and 15%. So if you have PCOS and you're not ovulating, your chances are significantly lower than that. I would say the other issue around PCOS is that it's often associated with obesity. Not in all cases, but in some cases. And we do know that patients who have obesity or who live with obesity have a lower chance of pregnancy, depending on how high their weight is. But I would say, yes, if you have polycystic ovarian syndrome and you're not ovulating, or even if you just know you have polycystic ovarian syndrome and maybe you don't ovulate as frequently, so maybe instead of getting 12 or 13 periods in a year, you're only getting 8 or 9 periods in a year, you definitely have a lower chance of pregnancy with that because you have fewer opportunities to conceive. So I would say definitely seek help from a fertility specialist. And in the meantime, if you're waiting, you can look at things like a diet that's low in carbohydrates, exercise. There may, even if you're able to speak to your family doctor, and depending on how comfortable they are, they might feel comfortable prescribing some pharmacologic insulin sensitizers like metformin and inositol. So those are the things that we look at when you come to a fertility specialist. But so if you don't have access to that, that's fine. But I would say you could optimize the other things like diet and exercise
Yeah,
in the meantime while you're waiting.
definitely, definitely. The next question we got was, when should I freeze my eggs? I plan on dedicating my 20s to my law career and realistically won't be ready to settle down until my mid to late 30s. I love this question because I feel like this is very real, even for myself. Currently dedicating
Mhm.
my entire 20s, well, it's ending this year, to work. So you're speaking to me and a lot of people at this point. So I'm listening, Dr. Williams.
So ideally, the best time to freeze your eggs is before you reach 35.
Before 35.
Yeah, that would be the ideal time. There's two very important factors in terms of the success when we look at egg freezing. So success being ending with when you're ready. So the most important factors are the age at which you freeze your eggs, and then the number of eggs that you're able to freeze. So the lower your age and the higher the number of eggs that you freeze, like the more eggs you freeze, the higher your chances of having a live birth in the future.
Mm.
So I would say if at all possible, like if it's if it's affordable to you and you're really thinking about doing it and really want to do it, and you're not ready to conceive at that moment, then try to do it before you reach 35. Um, Keeping in mind though that egg freezing, don't look at it, don't think of it as an insurance policy. I think a lot of people think of it like that, and it's not really an insurance policy because an insurance policy is supposed to pay out, right?
Yeah,
Whereas there's no guarantee that just because you freeze your eggs, you're going to have a baby at the end of the day. So what it does do is it preserves and extends your fertility. So let's say you got to 40 and you were thinking, oh my gosh, okay, now I don't have a partner and I'm thinking I still want to have a baby, but no partner. At that point, if you didn't freeze your eggs, you may have run out of your fertility. Whereas if you've frozen your eggs, you now have the eggs that you froze at whatever age before that that are available to you to try to use.
try. Yeah.
Yeah,
Yeah, I love the way that you put that, that it's not an insurance policy. Because I think even in the back of my head, I'm just like, it's an insurance policy. Like, at least by the time, I don't know, I'm late 30s, if I want to use those eggs, I feel reassured that there could be a successful outcome with it, but it's not guaranteed. There's
that's right.
no live birth guaranteed with just freezing your eggs as well. So, great question to whoever asked that. Thank you as well.
Yeah, great question.
Question number 4, why isn't infertility talked about? Question mark, question mark. I think this person really, yeah. Can you guys create some sort of seminar or event to educate us, please? I'm
Well,
assuming they're
I
talking
guess
about the Black community.
yeah, well, I
Yeah.
think like maybe, this is a forum for that kind of thing, so which is great. And kudos to you, Patricia, for actually, making the effort and taking the time to kind of, get the word out because I do think it's important. And you're right, we don't talk about it enough. I'm not sure why, except that maybe it's because, as women, we're kind of programmed to think, if I'm gonna fall in love, I'm gonna get married, and then I'm gonna have my babies, and everything will be fine. And I think we just programmed not to think about like the worst could happen, right? And I think also we spend so much time in our late teens, early 20s trying to prevent pregnancy that you never think, oh my God, this could happen to me, right? So but you're right. I totally agree that we should be talking about this in high school. There are so many people who come to me and they have no idea that, their fertility starts to decline in their early to mid 30s. So they just don't know. They've never been told that, and they see all these celebrities having babies in their 40s and 50, not realizing that, in a lot of those cases, those aren't necessarily their eggs, for example. Maybe they're using an egg donor,
Mhm.
or maybe it's their 10th cycle of IVF. And if you have, endless supplies of money,
Ash.
you could
Yep.
keep trying, right? But the rest of us in the world don't have that luxury, right?
Yeah. Gosh, that was such a great point with celebrity culture. Because I think I saw recently someone who's 52, I forgot which celebrity it was, but gave birth. And everyone's saying, oh, she did it naturally. This is why no one, like, but she's the exception, not the rule.
Exactly. Exactly.
Right? Like,
And
that
it's
may not make
not
every one of
likely.
us.
It's not likely. It's not her eggs. Uh, I don't know for sure, but
Yeah.
the chances of that happening are so slim, like less than 1%.
Wow.
Yeah. So it's very, very unlikely that it's her own eggs. But I mean, it is their own story to tell. And so, we don't have a right to that information, of course.
Sure.
But I wish as a just generally we would, be talking about that, the average, 45-year-old woman is not going to have an easy time trying to get pregnant. It's just not happening.
Yeah, but yeah, I completely agree. The next one I do want to give a trigger warning. It is a question about miscarriage. So for anyone who's listening, the person said, I recently had a miscarriage in 2023 and then about a year of infertility throughout 2024. It's been so hard on me, especially because my in-laws believe I'm the problem and they expected grandchildren, not even a grandchild, grandchildren, plural already. Please, what should I do at this point? That's tough.
Yeah, that is really hard. And I'm so sorry that she's going through that. Like the miscarriage is hard enough. And then to have the pressure, the family pressure, but it's an all too common scenario where the family is putting pressure. And it's I think it's more common in certain cultures as well. But certainly just by like I just want to reassure her that after having one miscarriage, there's no increase in your likelihood of having a second miscarriage. But miscarriage itself is relatively common. It's like 15 to 20% of pregnancies end in miscarriage.
Oh, wow. Okay.
But after one, your chances of having a second one are the same. It's not until you start to have two and three and four miscarriages that the percentage, the likelihood starts to increase because there's a higher chance that if you're having more miscarriages, maybe there really truly is something wrong.
Mm.
50% of miscarriages are related to something genetically wrong with the embryo itself. And so it's kind of Mother Nature's way of eliminating the pregnancy because there's something wrong with that embryo and it likely wouldn't even get to term. So, it ends up in miscarriage early. Um, but it's still difficult. It's still a difficult experience. And I would say that for the person who asked the question, maybe think about counseling or support groups. There are many support groups out there that um, offer support for people who are suffering one miscarriage or even recurrent miscarriage. I would also say it sounds like it's been a year since she's been started trying again. And so I would definitely say that she needs to see a fertility specialist for workup. Because she now also has some fertility. I'd say lean on your partner, for the support, and hopefully your partner is supportive. And I would also say consider maybe minimizing the amount of time you spend with the people who don't really, contribute to your well-being.
Yeah. She's saying it in a nicer way than I would. That's the way I would say it is just excommunication at this point and just prioritize your peace. Because coming from a Nigerian background, I read this and I thought immediately I thought the person was Nigerian. Only because of the family pressure, but I know other communities also have those sorts of things. And
Mhm.
I've heard of a million and one stories where people have come in and like kick the wife out or try to replace the wife with another woman and all sorts of scenarios like that, that at the end of the day, you and your partner, you need to prioritize your peace and your sanity and let the in-laws stay in their lane and you walk in your lane and figure it out together as a couple.
Yeah,
Because I think it also does more harm than good to like your psychosocial wellness overall.
I agree. I agree. In some cases, it can drive a wedge too in the relationship, right, between you and your partner. So that's, it's just not healthy at all.
Yeah, at all. Okay, we have two more. All right, so the next one, it says, I am infertile because my family doctor didn't listen to me in my early 20s when I had severe period pains to the point where I had to take days off every month. I now have stage 4 endometriosis. What are my options? I don't have a partner yet, but I'm even dreading having this conversation with him in the future. Also, thank you for creating this platform. Well, you're welcome first. Over
Yeah,
to you, Dr. Williams.
it's a great question, actually. It really is a great question. And I get this a lot too, but I want to start with just reassuring her that even if she had been diagnosed with endometriosis in her 20s when she was symptomatic, and I agree with her that it would have been appropriate to do the investigations then, whether or not the diagnosis would have been made, it's unclear, but still making the diagnosis at that time wouldn't guarantee that now at this time she wouldn't still have stage 4 endometriosis.
Oh,
So
okay.
she could have been diagnosed and treated and still progress to stage 4 endometriosis. And the thing about endometriosis is it's a disease that is debilitating, and we have just scratched the surface of what we know about it. There's probably a difference between the woman who develops severe endometriosis and the woman who has minimal or mild endometriosis and it stays minimal or mild throughout her life. They might be two different diseases. We don't have the data to confirm that yet, but we definitely need more research about endometriosis. And sadly, I think this is a comment on our society that, it's a woman's disease, right? So it doesn't get the same attention as
Yeah.
men's diseases do. So we need more work on endometriosis to actually figure a lot of stuff out, because we don't know what we should know about it. We really know minimally about it. It's getting
Yeah.
better all the time, but there's just so much more that we could know.
Learn. Would you
Yeah.
categorize it in the same as like the lack of study being done in with fibroids? Like we don't know as much as we should.
Yes. Yeah. With a lot of women's diseases, right? Polycystic ovarian syndrome, probably the same, right? Adenomyosis, which is kind of a little slightly different version of endometriosis. But a lot of these diseases we really don't spend enough time on. And in fact, I was looking at an article today about the fact that women are more likely to have adverse reactions to medication. It speaks to the fact that in a lot of the studies, that pharmaceutical companies run, they don't include a lot of women in their studies, and so the dosing is really designed around men.
And
And so we're using the same dosing for women who have different physiology, we're different size, we're different, everything, hormones, etc. All these things that could impact the way they respond, and they're not included in the studies. So we definitely need more work on this for sure.
definitely.
I would say to her, because she was saying, what do I do now? Because she doesn't have a partner. So I think a lot of that depends on what she wants now, which is, does she want to be pregnant now? Or does she just want to preserve her fertility for the future? And so if she doesn't want to be pregnant now and she wants to preserve her fertility for the future, I would say, she should really try and speak to a fertility specialist about egg freezing, because that's an option for women with endometriosis who don't want to get pregnant now. There's also the option of embryo freezing, right?
Mm,
So instead of just taking the eggs and freezing them, you can take the eggs out, fertilize them, and then freeze them. And the benefit of that is the plus side is that you actually know how many embryos you have, because you can freeze 10 eggs and you may get 5 embryos or you may get one out of that. So you really don't know.
Yeah.
Whereas if you freeze embryos, you will know at the end of the day, okay, I have 3 embryos frozen. So now I know I have 3 tries to get pregnant. The downside, of course, is you fertilize those eggs. So if you meet someone in a few years and you want them to be the biological father of these eggs, to make these embryos, that opportunity is taken away because you've already fertilized the eggs with
Yeah.
donor sperm, right? But those are certainly 2 options. And then if you want to be a mom now, then there's the option of being a single mom. And you can also talk to a fertility specialist about that, because you could, as long as your fallopian tubes are open, you could try doing just artificial insemination using donor sperm if you don't have a partner right now.
So many great points. Ooh, thank you, Dr. Williams. And last but not the least, I have
Okay.
a diagnosis of unexplained infertility. I actually had to Google this. Even though I'm in this industry, I'm just like, wait, what is unexplained infertility? So this person said, I have a diagnosis of unexplained infertility. The last 5 years have been challenging to say the least of trying to have a baby, but being unsuccessful. As Christians, we've been believing God for a miracle. Is IVF our only option? Are there any natural help remedies or help?
Okay, so unexplained infertility, it means that we've done all the tests that we typically do. And the tests that we do really do just look at the macro environment around fertility. So, we look for, are the fallopian tubes open? Is the uterine cavity normal? Do you have eggs? Do you have sperm? Do the sperm swim? Those basic things are what we look for. And if we can't find anything wrong there, we call it unexplained infertility. So that's all it means.
Yeah.
But 5 years of unexplained infertility is a long time, and really suggests that the chances of getting pregnant on your own are really slim, probably like 1% or less per month.
Wow.
If you're just trying by yourself, if you have been trying for 5 years, they haven't found anything wrong. So, I mean, my impression from the question is, is IVF the only option you have? It may not be. I mean, unfortunately, it is the best option that's out there after 5 years. If you've been trying for 5 years, I would say that IVF is definitely your best option. But in terms of like natural remedies, again, I think, things like, trying to start an anti-inflammatory diet. So, for example, whole foods, nutrient dense foods, healthy fats, lean proteins, making sure that you're exercising all the time, as regularly as you can, increasing the antioxidants like coenzyme Q10 and omega 3s, those kinds of compounds can help improve egg quality and sperm quality. Try to balance your blood sugar, making sure that you're avoiding processed and ultra processed foods, which are probably the worst for us generally, for general health, but also for reproductive health. I mean, some suggest maybe that having dairy and gluten, if you have any kind of sensitivity to dairy and gluten, that they could produce more inflammation in your body and make it harder to conceive. So you could consider, having a dairy-free or gluten-free diet. That's something to consider. You could also consider seeing a naturopath, because sometimes they can do some investigations that are a little different from what we do in terms of looking for, sources of inflammation, and also maybe consider, applying acupuncture, which there is some data to suggest that acupuncture increases blood flow to whatever area, depending on where you're putting your needles, and also decreases stress levels. So maybe acupuncture might help. The other thing too is to make sure that you reduce your exposure to what we call endocrine disrupting agents. So things like, plastics, which contain BPA, which we know affects hormones. There's some
So
compounds like
did you say plastics? Like
yeah,
plastic water
plastics.
bottles?
Yeah, plastic water bottles. Yeah. So remember now there's all these BPA free water bottles. So get rid of the ones that are not BPA free because BPA is an endocrine disruptor. Make sure that you're, like things like parabens and PABA, like if you, some of your beauty products might have that in there. So you
Yeah.
get rid of those in your life. I would say also non-stick cookware. There's some evidence to suggest that there are endocrine disruptors in there, and these with these Teflon products. And I think too, I think there's a tendency to think it's always the woman's issue. But we have to remember that the men are contributors too. So, they should also be, quitting smoking, reducing their caffeine, reducing their alcohol, improving their diet, exercising, all of those things, taking antioxidants. So don't forget about the men.
I love that. That's the best way to end this conversation. Don't forget about the men, and Patricia needs to stop drinking out of water bottles.
Yes,
This is
get rid
number
of those.
five.
So get a like a water bottle with stainless steel.
So, Dr. Williams, there's something that you need to know about me. I'm kind of lazy. Like, I have all these things going on. Washing my water bottle, chore. Let me just grab another water bottle from the deck instead. But
Oh,
thank
yeah.
you so, 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 so much. And this brings us to the end of the interview. Thank you, Dr. Williams, for your time. We sincerely appreciate all the work that you've done in your expansive, gosh, I think it's 30 years plus at this point in your career. And we're so grateful that you took the time to talk, chat with us this evening.
Thank you so much for inviting me. I really loved it, and yeah, it was less intimidating than I thought it was going to be.
No one would believe that. Let's not tell them, but yeah, Dr. Williams are great. I tell you this all the time when I talk to you,
Thank
but I'm
you.
really grateful. I loved that conversation with Dr. Williams because as you heard from her, she not only, you know, focuses on what you should do in the now, but what you should also do in terms of next steps and provides a slew of different avenues that you can explore, whether that's naturopath or vitamins that you can take or, speaking to a specialist. Dr. Williams is probably one of my favorite physicians. And did you know that we're actually partners with Dr. Williams at Create Fertility Center? So if you would like to explore your options with Dr. Williams, please fill out the intake form in the description, in the YouTube's description below, and someone at BFA will get you started. As always, don't forget to like, share, leave a comment below. Most importantly, subscribe, and we'll see you in the next interview. Bye.